This picture is inside someone's actual face, posted by Mark Pacifico, who's the president of the British Association of Aesthetic Plastic Surgeons. To quote his caption in the post, the thing that caused this horrendous result was an injectable used to volumize and tighten the face called Sculptra. According to scientific papers like this, it works by creating inflammation in the body, and it's possible to have an adverse reaction to it even almost 6 years after it's injected, even though its sold as disappearing from where it's injected after 2 years. There's a lot of injectable products that try to create collagen, and frankly, if they work by inflammation or fibrosis, then my honest advice is to walk away, because, number one, what happens when the inflammation reaction finishes? Are you going to keep getting injected the rest of your life to sustain the reaction? Is it healthy to even keep undergoing inflammation? Chronic inflammation is infection. Number two, if this is the way it looks when you treat people by inflaming them or making them undergo fibrosis as opposed to healthy physiological improvements, then who in their right mind would want this inside them? If you want to tighten your skin, okay, listen, there's healthier things out there. Use things like Suncost, which doesn't work by fibrosis or inflammation, but by making the skin actually healthier, physiological improvements. I think the reason people still use Sculptra nowadays is because the marketing is pretty good, because it's been around for so long, and coupled with the fact that doctors, I'm sorry to say, don't always look into products in detail. They just see the surface look smoother due to the inflammation and things like this happening underneath. They don't seem to have enough brain cells to question what the internal change is as a result of the inflammation. In fact, I met a doctor recently that genuinely taught people to use Sculptra to try and treat cellulite. Now, frankly, you have to be an absolute idiot to think that makes physiological sense, but he's been doing it and seeing smooth skin on top and thinking it works without realizing that actually nothing's worked. It's just that the inflammation and fibrosis underneath causes that much reaction that the skin on top looks like it's puffed out and smoother and therefore treated cellulite. Stay the hell away from products like this, and don't fall for doctors who sell you treatments that don't understand whether it works by inflammation or by physiological improvement. If you really want to tighten the skin, then use top quality skincare like this, inject injectables like Suncost, and then use a device like the Lutronic Genius or the Cytin Halo laser.